Hello everyone, I am a professional esthetician and cosmetologist. Today, I will give you a complete guide about the trendy Kybella treatment. What it is, its procedure, costs, benefits, dermatologist reviews and more, to give you best advice for this treatment, so watch complete video, subscribe my channel and hit the bell icon, not to miss the latest updates. Section 1. What exactly is Kybella? Let us start with the science behind Kybella, because understanding exactly how it works will help you decide if it's right for you. Kybella's active ingredient is synthetic deoxycholic acid. This is actually a substance your body naturally produces in your liver to help break down dietary fats. But here's the key difference: while your body makes small amounts for digestion, Kybella contains a concentrated, pharmaceutical-grade version specifically designed to target and destroy fat cells permanently. When injected in your skin, the solution disrupts the fat cell membrane. This causes irreversible damage to the cell structure. The destroyed fat cells release their contents. Your body's lymphatic system gradually flushes them out. The empty fat cell shells are then absorbed and eliminated, thus reducing fat and giving you the best shape. Kybella was approved by the FDA in 2015 after extensive clinical trials. Interestingly, researchers discovered this application while studying deoxycholic acid for other medical uses. It's manufactured by the same company that makes Botox, Allergen. Kybella is currently only FDA approved for submental fat, under the chin area, as fat in this area is often resistant to diet and exercise, and its anatomy allows for precise injection placement. Kybella chemically destroys fat cells through a natural biological process. This makes it unique among non-surgical fat reduction options. Section 3. Kybella treatment process. PRE treatment preparation. Your esthetician will thoroughly review your medical history, paying special attention to any history of difficulty swallowing, previous facial surgeries or treatments or current medications. The esthetician will manually examine your submental area to assess fat distribution and thickness to check for any unusual lumps or irregularities. Step 2. Using a surgical grade marker, your esthetician will carefully map out the injection points in a precise grid pattern. Step 3. While Kybella injections use very fine needles, most estheticians offer one of these comfort options: topical numbing cream or ice application or local anesthetic injection. Step 4. Skin is cleansed with alcohol. 4 to 6 mm depth syringe is inserted into the subcutaneous fat layer. It will destroy the fat cells to reduce the bumpy look of your double chin area. Dosage is 0.2 to 0.3 milliliters per injection. Step 5. Post-injection care. Gentle massage to distribute solution. Ice pack application for 20 minutes. Head elevation positioning. Section 3. Side effects and recovery timeline. Kybella has some very specific side effects you need to be prepared for. Common side effects, expected in 80% of patients, are significant swelling, often called Kybella bullfrog neck, bruising and tenderness, numbness or hardness in treated area, mild redness at injection sites. Now let's explore less common side effects, but important to know. These are: temporary difficulty swallowing, usually resolves in 1 to 2 days. Nerve injury, very rare with experienced providers. Uneven results if injection pattern isn't precise. Recovery timeline. First 3 days, peak swelling, may look worse than before. 1 week, 50% of swelling subsides. 2 weeks, can usually cover remaining swelling with makeup. For weeks, final appearance starts to emerge. Section 4. 2025 cost breakdown and financing. Here's the reality about Kybella costs in 2025, per vial pricing. $600 to $800 per vial. Most patients need 2 to 4 vials per session. Average session cost: $1,200 to $2,500. Full treatment cost: 2 to 4 sessions. $3,000 to $6,000. Important factors affecting price. Geographic location: big cities cost more. Provider experience: board-certified estheticians charge premium. Number of vials needed, based on your fat volume. Section 5. Professional dermatologists reviews. According to Dr. Emily Sanders, cosmetic dermatologist, NYC, Kybella works best for patients with moderate submental fat and good skin elasticity. While swelling is significant for 7 to 10 days, the permanent fat reduction makes it worthwhile for the right candidate. According to Dr. Raj Patel, facial aesthetics specialist, London. I use Kybella cautiously, it's effective but requires precise technique. Patients love the natural-looking results, but they must commit to multiple sessions and proper aftercare. Section 6. How many sessions do you really need? The number of sessions varies, but here's the typical progression. After one session, 20 to 30% improvement, but still swollen. After 2 sessions, 50 to 70% improvement, most patients stop here. After 3 to 4 sessions, 80 to 100% improvement, for stubborn cases. Sessions are spaced 6 to 8 weeks apart to allow full healing and see true results before deciding if more is needed. Section 7. Who should avoid Kybella? Kybella isn't magic. It won't work well for everyone. Candidates who should avoid it include those people with significant loose skin because Kybella only removes fat, not skin. Those people with very minimal fat under chins, it is not enough to treat. Those patients with certain medical conditions like autoimmune disorders, swallowing issues. Anyone who is expecting instant results because this is a gradual process. And for loose skin, aestheticians recommend a neck lift instead. These are the people who should not go for Kybella. Section 8. Alternatives to Kybella. If Kybella isn't right for you, consider these alternatives. 1. Cool sculpting, which costs $700 to $1,500 per session. It freezes fat cells to give best shape, requires 1 to 2 treatments, and has risk of the treated fat cells enlargement instead of shrinking called paradoxical hyperplasia. 2. Aqualix treatment, popular in Europe, it is similar injectable fat dissolver. It is less FDA research than Kybella. 3. Laser lipo, which costs $3,000-$5,000. It is more invasive but faster results, it can tighten skin slightly. Section 9. Final verdict, is Kybella worth it? After all this information, here is the conclusion, should you have to take this treatment or not? It is good for those people with moderate fat under chin, those people who want permanent results, and anyone avoiding surgery. While it is not ideal for those people who want significant loose skin, those people with very minimal fat, those people needing instant results, so if you decide to move forward, always choose an experienced, board-certified provider. Cheap Kybella often leads to poor results. If you found this guide helpful and best, like and share this video and subscribe my channel, not to miss latest updates. Thanks for watching.